patients, in most cases, to not need as high of a dose as most other people out there. And that's the reason, guys. So I hope that made sense, because I did have a question of why we dose lower. And it's an essential piece of easier success at the end. Because what is more important than you guys hitting your weight loss goal when you work with me? It's being able to wean off the meds and maintain your weight. That, to me, is way more important than you losing 100 pounds. It's being able to lose 100 pounds and maintain that 3 months, 6 months, 1 year, 5 years later. All right. So we got medication dosing. Okay, so how long does it take for the meds to kick in? Okay. This is so how long does it take for GLP-1 medications to kick in, to shut off my food chatter, right? The literature establishes a protocol for safety reasons, whether it's semaglutide or tirzepatide, which is 4 weeks at a lower dose, 0.25 for semaglutide and 2.5 milligrams for tirzepatide. If you didn't do this, there's a greater likelihood that you're going to get trashed, you're going to get thrashed by the side effects. Trust me when I say this. Nausea is a very common side effect in about 1/3 to 1/2 of people using this medication, and it gets worse if you are impatient. So don't do that. 4 weeks of that initial dose. Now, for some people, in that dose, they feel it right away. And that's great. A lot of you, some of my patients are staying at 2.5 because they were like, wow, I feel like my issue's taken care of. And as I said earlier, based off of my definition of what's the lowest dose, why would you go up? For other people, though, 2.5 doesn't do anything. Okay? 5 milligrams might not do anything. 7.5. The reality is that it takes the amount of time it takes for you to get to the dose that's necessary to shut off your food chatter. Okay? But guess what? Since I don't want you to just wait for the medication to work, I want you, if you don't feel it by week number 1, to start doing all the other things that we have for appetite suppression. We have the Unicity product. We have the Cali Curb. We have freaking nicotine gum. We have all these different options to help you manage your appetite so that you don't have to get so high on tirzepatide. So, on average, guys, in my program, week 5, week 6, that's about when you get to the 5 milligrams, and that's when most of my patients are like feeling great as far as the effects of the medication. But some of you might feel it a lot sooner. Okay. Related to this video, we're going to talk about Tesofensine now, because some of you guys are taking Tesofensine. Tesofensine is my backup option for GLP-1 medications, because for whatever reason you couldn't get probably medically qualified for the tirzepatide. So Tesofensine does have a very long half-life. So as you're like a week long too, it's crazy. So every single day you're taking the next dose, it's building. At about 1.5 weeks to 2 weeks, you're at that peak. And so if you feel no effect of Tesofensine, or some, but you want more, that's where you have the option of increasing your dose to 2 pills a day, or possibly you can stagger, maybe 3 pills a week. You go 3 days a week, you go double, or double on your fasting days. But with Tesofensine, same concept, guys. I want you to maximize all the other appetite suppressing options that we have in the supplement form to help you achieve the goal. And remember, guys, mindset is one of the appetite suppressing options you have. What do I mean by mindset? Accepting the fact that this is going to be a challenge and executing on that. Now, I know that for some of you, you're doing this because you are already trying your best. And so great. If you really are trying your best already at all times, then okay, then this doesn't apply to you. But if you can be honest and straight with yourself and say, am I really challenging myself? Within the degree that I can challenge myself, because I have a family, I have a job, I have other responsibilities, yada, yada, yada. Totally respect that. But get honest and straight with yourself. Am I challenging myself mentally as much as I possibly can for this program, for my health? And this is where I've talked about my mindset videos, guys, of why are you doing this? Is it just to lose 20 pounds? Why do you want to lose 20 pounds? Getting into the why. If you haven't seen those mindset videos, guys, please watch those because those are very powerful. And mindset is everything. That's going to be the thing that drives you for the rest of your life is your mindset. But right now, what's clouding your mindset is food chatter. And that food chatter, in my opinion, is produced from insulin resistance, inflammation, and metabolic flexibility. Those are physiological barriers to being able to even develop a strong mindset. You can't walk into baseball and play in the major league, right? You can't do that. You got to start with the babies, the minors, the before minors. That's what the drugs, the peptides, the medications do. It's like taking you out of majors and putting you into a league of your own where you can play. And what happens when you play? You get better. When you start to lower your hunger to an adequate level that goes from impossible to hard, guess what? Hard is doable. We can't expect for everything to be easy all the time. Of course not. And I'm not saying any of you are expecting that. I'm just, again, speaking to everybody here. We want to make it easy enough to accomplish, and you guys have to make a decision for yourself how easy or medium or hard you want to make it for yourself based off of your life, what you can afford to do, because more medications cost more money. I get that. That's your guys' decision. But I'm going to guide you, as long as we have the same goal, getting to our weight loss and following the protocol, then I'm going to guide you however you guys want to get there. Okay, great question. I tangented there, guys, but as you guys know, I'm always going to run with a good idea and a good topics. Okay, another great question. Do some people take tirzepatide and tesofensine together? Yes, I've tried both myself. It's very powerful. Now, of course, if you're on 5 milligrams of tirzepatide and you're on 500 milligrams of tesofensine, that's not going to be as powerful probably as 10 or 15 of tirzepatide only. So when I say powerful, it's powerful relative to 5 of tirzepatide only. But I think when I look at the side effect profile, I would rather take 500 milligrams of tesofensine and the 5 of tirzepatide than going to 10 or 15 of tirzepatide, guys. Because we want to have a moderate level of each medication rather than having a moderately high or high of one, because tirzepatide and tesofensine target completely different systems. Completely different systems. But they accomplish relatively safe appetite suppression. And tesofensine's nice. Tesofensine actually increases your metabolism. Tirzepatide doesn't. Tirzepatide makes you insulin sensitive. Tesofensine doesn't do that. Both of them suppress appetite, so you can imagine combining both is a really powerful combination. Great question. So, AOD, I'm trying to think if I have videos on the impact of AOD. I know I do, Colleen. So in FLOA University, you can check out my videos on AOD. So I'm just going to briefly talk about it. AOD mobilizes body fat. And so mobilization is essential as the first step of burning, but it's not the burning. Burning comes from either exercising more or eating less, creating a caloric deficit. That's where the GLP-1 medication comes into play. That's where the tesofensine comes into play. You got to mobilize the fat, then you got to burn it. The combination of both are supercharging your results. What's funny, Angela, is the last topic we're going to talk about today is, let's see. No, actually, we have weaning. Never mind, Angela. We talked about that. So I have a ton of videos on weaning off, Angela, but I will say you're asking, do you transition to tesofensine? That is not necessarily my protocol, right? Because the weaning off is a very much individual pathway that you guys are going to take. Okay. So make sure you guys watch my videos on weaning off, but can you transition from tirzepatide to Teso? Absolutely. Right. You can slowly decrease your dose of tirzepatide. You can cut it cold turkey. You can transition to Teso. You can transition to the other supplements, right? You just have to find whatever vehicle as you're transitioning and decreasing the aids, your parameter is, am I maintaining results? Am I maintaining weight? Is my body composition staying the same? As long as your body is staying the same, you just got to decrease the aids, right? The drugs, the peptides, the supplements, right? And the appetite suppressing supplements, I will always take those on my fasting days for the rest of my life. I just don't take them every day. I'll still use tirzepatide during holidays. I'll still use tirzepatide vacations just because I have access to it a couple times a year. I have no problem with that, but you don't need to. That's just because I have access to it. And if people have access to it and can't afford it, that's just a little perk. But if you are in a financial constraint, you absolutely don't have to do that at all. Yeah, Angela. So this is definitely talked about in the FLOA University as well, continuing to lose weight on the FLOA protocol without medications, right? So if you don't want to use more medications, then you just have to literally just continue with the protocol, but utilize the supplements to help you to help you get into the fasting. It's the fasting that's going to get you more results. 48 hours every single week, eating enough, not hitting a plateau, adding resistance training, adding maybe some high intensity cardio, and continue with the fasting. And then you could use nicotine gum. Nicotine gum, guys, not only will help you with your appetite, but nicotine gum actually is a potent fat burner too as well. And it's affordable as well. All right. Yes, Paula, supplement recommendations do not change during your fast. So whatever supplements, medications you were taking or are taking, nothing changes. And I have videos on how to deal with nausea induced from taking supplements on an empty stomach. So just make sure you can work into it and handle it. But yes, don't change anything during your fast. What you're going to add that you wouldn't have to do otherwise would be your electrolytes and your extra salt, of course. Okay, somebody did ask a question regarding the diet, which all of those videos are on FLOA University, so I'll touch on it very quickly and then check out the videos of diet and FLOA University. But our diet is, and I think I even mentioned it on earlier today, our diet is simple in the FLOA protocol. We want to reduce the intake of processed and ultra-processed food. I always mention paleo and Mediterranean. But when we start talking about ethnic foods, I don't know all ethnic foods, but I can tell you there's probably a good amount of ethnic foods that don't fall into the paleo-Mediterranean category. That's completely fine. The key is unprocessed. So I can call this the unprocessed diet. Let's call it the unprocessed diet. Then people say, what does that mean, right? Paleo-Mediterranean is something you guys can Google, which is why I always mention paleo-Mediterranean. But really, it is anything that's unprocessed, whole natural, organic when possible. I will touch on that as well in a second because that relates to diet. And we want to adhere to the 90-10 rule. 90% clean, 10% is where your junk food can come in. Everything that's processed, right? Alcohol falls in that category. And as we mentioned earlier, we're taking a keto version of this unprocessed diet for the first 2 months, give or take. Okay. We got a lot of people on today's chat. This is super awesome. Do me a favor, guys. I want to see just some updates from everybody. It's always awesome. We got this community going. 25 is actually the most I've had in a while, which is great. I know we had a lot of people enrolling. Do me a favor, guys. Real quick, how long have you been in the protocol? How much weight have you lost? So when did you start, or how long have you been doing it for? How much weight have you lost? Please put that in the chat so that the rest of us can see. Thank you so much, Ursula. That's very sweet. I haven't seen you on for a few weeks. It's always motivating for the rest of us to see how the community, how the group is doing, guys. So please, how long have you been doing this program for? How much weight have you lost? Are you still in the protocol, or have you already hit your goal, and are you just maintaining now? Nikki just got started. Super awesome. Teresa, 8 weeks, 20 pounds. Nancy, starting week 3, down 10. All right. Kicking butt there. Awesome. Lost 35 pounds. 3 sizes, suffer autoimmune diseases. Angela, did your autoimmune diseases change at all? Because that's a very common occurrence in this program, is people's autoimmune diseases either go into full-blown remission or the symptoms decrease. And if they didn't, that's fine too, but I really would like to know that, if you wouldn't mind sharing that. First week, 3 peptides or 3 pounds down before peptides even came in. That's awesome. Teresa lost 32 pounds in November 8th. That's so stellar. Awesome. 15 down, 20 to go. 8 weeks, 10 pounds. 3.5 months down, 36. Should we lift on fasting days? In the beginning, I don't want you guys doing that. That is more of an advanced technique. Once you get really fit and you're closer to your goal, or you're at your goal, you can lift on fasting days. Down 70 pounds. Oh, both prior to us, Barb has lost 70, and now she's starting my program. Fantastic. Maria, I know that you've been in communication with the FLOA hotline, so make sure, if you don't feel like you have a current thing that you're working on with us, make sure you text us so that we can figure out if you're already on a handle for that. If I remember correctly, we were doing a reset with you, but yeah, just make sure, because we're going to get you there, Maria. Don't worry. Working on getting my calories up, Debbie. That's right. We got to fix that. We had a lot of people that came into me and they were barely eating. And so we got to get the eating going. We got to eat. We can't. And what I mean by that is we got to fix the metabolism. You can't start weight loss unless you fix the metabolism. Just reading some of these questions here. Question about anti-inflammation diet and keto. I have a very well-managed autoimmune disease, basically in remission. So what is your question, Colleen? Are you saying, can you follow an anti-inflammatory diet? Absolutely you can. Anti-inflammatory diets, autoimmune diets, are very restrictive. And so that's why I don't push that to everybody like a lot of weight loss programs do. Although you certainly can, and you will feel better, and you probably will lose weight faster. Some of you on an autoimmune disease, though, will absolutely need to do an autoimmune diet, which is basically a very restrictive diet, to remove those triggers, dampen that inflammation so that you can start the weight loss. Oh, awesome, Angela. Yeah, so you're basically, you felt a window of feeling better, but now you have triggers. So I'm sure, Angela, hopefully you're taking a good amount of curcumin, fish oil, resveratrol. I would regularly heal the gut. I would do a gut healing program. That's why BPC helped you so much. My gut healing supplements are helpful too as well. Maria, remember the FLOA hotline is text only, but let them know if you feel like you, like I said earlier, if you feel like you're in a plateau and you don't know what you're doing, or you don't have a program, like, that's not okay. Make sure you text the FLOA hotline and we can come up with a solution for you. Ooh, Kim is noticing about month 3 that she can tell finally. And look, the hormones, Kim, it's insulin resistance. When I'm not sure where you're at, because I'm just looking at the Facebook. I have no idea where you're at. But regardless, for women, when they hit certain ages, or if they hit menopause or premenopause, the insulin resistance just skyrockets. So that's great that you're starting to see. And sometimes it takes time. This is why I want you guys to do the protocol, the keto, for at least 2 months, because sometimes it takes a while of this fasting before your body starts to respond. And look, a lot of people will say keto for 9 months before you really start to become insulin sensitive. But you did it in 3 months because the fasting. It's because I have you fasting more than anybody thinks is possible. Okay, Lynette, you're going to be getting started. Of course, Lynette, Tesofensine is not as flashy. Everyone's talking about the GLP-1s. Don't get bummed out about the Teso. It's not as strong, but I've had plenty of success with patients on Teso. Combine it with the appetite suppressing supplements for the best results. Kim having huge problems with muscle cramping, taking salt and electrolyte 3 times a day for the last 3 days. Hope that works, because wow, does it hurt. Yes, you don't want to mess around with muscle cramping, Kim. So if it's 3 whole days and it hasn't stopped cramping, I would say go to the ER, but I don't know how bad the cramps are. And next time, now you know how much salt and electrolytes you should be taking to prevent the cramping from starting. So make sure that's getting better and not getting worse. Yes, Colleen, if you have an autoimmune disease, you want to absolutely be on a more anti-inflammatory diet approach. And because we're doing 2 things here, we're not just treating your autoimmune disease, but we're also trying to treat your insulin resistance. I know that makes your autoimmune diet even more restrictive, but you want to do your best to do a keto version of your autoimmune diet to the best of your ability, so that we can tackle both the insulin resistance and the inflammation. The FLOA hotline number, guys, is in your welcome to form. I can pull it up here. You think I would have that memorized? We just got new numbers. And that is not pulling up on my side. What is going on? Give me 1 second. Let's see. If somebody has the FLOA hotline number, if you can pop that into the chat, please. So, Nikki, do we text the FLOA hotline if we should start with the reset? Nikki, what's supposed to happen is during your initial coaching call with me, that's where we establish if you need to start with the reset. So have you had your coaching call with me yet? And if you did, we would have discussed it. But for whatever reason, if you think that maybe it didn't get brought up, or maybe you read it and you think that, okay, then there you go. We will discuss that during your initial coaching call. Make sure you read that section so that you fully understand what a reset is and all that jazz, so that we can set your initial calorie goal. Barb, you're talking about retatrutide. You can't get retatrutide. It's probably going to be available in another year, and it looks really powerful, but I'll be honest with you, tirzepatide's already powerful enough. So they keep trying to make these drugs stronger because all they know how. Imagine you are a engineer trying to build stuff, and the only tool you have is a drug. That's all they have. So if I want better results to build, I need stronger drugs. But me, I'm an artist. I have drugs. I have supplements, I have lifestyle intervention, I have mindset coaching, right? So you guys picked a good team to join because I have a ton of tools. And so when retatrutide comes down the pipeline, sure, I'll have it available, but it's not going to matter. Retatrutide, tirzepatide, it doesn't matter. The drug is a powerful tool, but it's just a tool. The lifestyle, guys, is going to get you to where you need to go. All right, guys, that was awesome. And it's always more fun when we have more than 3 people here. With the holidays and everything, I think people were just busy. But now everybody's awake. Everybody's ready to start this year and kick some butt. And so super, super excited to be working with you guys. And let's see if I'm scanning, make sure I didn't miss any questions. Oh, yes. One more thing, guys. If you have been with us for a couple months already and wouldn't mind sharing some pre and post pictures, I know some of you did videos already. Now my marketing team tells me they want pictures, and we were never asking for pre and post pictures. So if you guys wouldn't mind at all, greatly appreciate it. If you wouldn't mind sharing some pre and post pictures, that would be very helpful. There has been some text messages going out to you guys with the link that you can just use your phone and click that link and pull the photos from your phone. So that would be tremendously helpful, because that always helps other people, of course, when they see the pre and post pictures and all that kind of stuff. Also, too, want to remind you guys, I have a really good referral program for all of you. So 10% of any referrals, that whatever they do can be used for you for credit towards maybe more services or more peptides, things of that nature. So just want to let you guys know that referral program with January. If you do have somebody that you want to refer, you can send them to weanoffmeds.com. That's our new landing page. It's really easy to remember. I'm going to put it in the chat here. Weanoffmeds.com. And just let them know when they fill out the form to put in the notes that they that you referred them. That way we can establish and then have a documentation of the credit. So, all right, guys. Well, enjoy the weekend. Go Niners, guys. I know we have a ton of Niners fans here, so I'm just going to say it. Go Niners. They're going to kick some Packers butt. And with that Buffalo and KC game, I'm hoping Buffalo's going to cover. We'll see you guys later.